The third and fourth patient that had died on the previous weekend to this one that just went by, they had had interaction with the system, practically very minimal. In the case of one patient died while receiving care at a private institution. The other patient arrived, none of these patients, by the way, arrived to the private or public institution with a diagnosis of SARS-CoV-2. Those, in both instances, they had a diagnosis made after they had died. That's the previous weekend. Almost sudden deaths, if you will. We are now considering, based on what we are finding and based on what's described in the literature elsewhere, that these could have been just prothrombotic events. And we mentioned it at the last time I was here. People who have SARS-CoV-2 are more likely to develop clots, and that contributes to issues such as stroke, myocardial infarctions, and pulmonary embolism in the lungs, and that can lead to a patient's demise. The fifth patient that died was towards the end of last week. That patient had a confirmed diagnosis of COVID-19, had been on a ventilator, and of course developed sepsis as a result of widespread infection, which is what can happen when people have been exposed in a prolonged ventilation situation. The sixth patient is a female patient that was brought from San Pedro and had other liver conditions. She was swabbed just because she was from San Pedro, and when people are deteriorating quickly, you need to find out if there's any other possible contributing factor. That's when we made also the diagnosis of this patient. It's a female. It would seem, therefore, that in the last 6 cases we have had, it would seem that 5 of those cases at least would have had stages where they would have had prothrombotic events, means that they have clots that would have triggered a myocardial infarction, emboli in the lungs, clots in the lungs. We have a patient still at Carlucia who had a stroke, an 85-year-old male who is also positive for SARS-CoV-2, not intubated, not ventilated. He might actually be discharged anytime now if he hasn't. So those things are what we are looking for our context.